How is everybody doing? And welcome back for another Strength Chat episode. Today, I'm joined by a very special guest for you all. She's a powerlifter that focuses her practice on athlete rehabilitation. Today, I am joined by the one and only Dr. Goguen-Locke. How are you doing?
I'm good. How are you doing?
I'm very well, thank you. Thanks a lot for taking the time to jump on. I suppose the first question is, what have you been up to? What's kind of been happening in your world recently?
Oh my gosh. Well, a lot. I mean, most people have seen through the rumor mill what we went through over Christmas time with my husband having his bicep surgery and subsequent life altering allergic reaction to anesthesia. So, honestly, just getting back to normalcy has been incredibly comforting.
Yeah, I was lucky enough to speak to Stu actually a couple of months ago. Obviously, it was I thought it was amazing him talk how he spoke about it, how he kind of like came out of the other side of it. But I suppose it's interesting as well. This might be a little bit of a tangent, but like how are you around that time? How is everything kind of now with you, if that makes sense? Looking at the other
So
side of it.
funny because like when he talks about it, it's totally different. I think the tone because he actually wasn't there,
Right.
right? He was essentially asleep through the worst time of it.
Yeah.
I think I was able to keep my faith up, but I also got to like test limits of myself that I didn't really know existed. I've never actually pulled an all-nighter in my life. It's
Wow.
like what you try to aim for as a kid at sleepovers. I've never been able to do it. I've always been an 8-hour girl. And I actually went 72 hours without sleep at one point.
Wow.
And I have obviously read about sleep deprivation and what that can do to the body, in my time studying, but actually going through like hallucinating and like body temperature elevation and everything that comes with that was like a really crazy experience. I mean, I don't think I'll ever go through something that will keep me awake that long again in my life, hopefully. But yeah, no, it was a wild experience.
Yeah, but things kind of back into the standard, the normal routine now, kind of from your side as well in terms of work, training, that side of things.
Yeah, and it actually came at the worst possible time because I was going through a clinic transition because I also own an in-person practice. And I went through that transition the same time that Stu ended up in the ICU.
Oh,
So I had 4 days to build out a clinic after we got back from the hospital,
wow.
which added to like the level of stress that I was, already carrying with sleep deprivation and all of that. So that was crazy. And then, January, of course, was like one of my busiest months in practice that I've ever had. But it's been really a huge blessing and, rolling the ball in this new clinic. Now I have it all built out with all powerlifting equipment. I have all the things that I need, all the specialty bars and everything. So I'm really happy with how that came together. It's just kind of, it was definitely a struggle with that happening all at the same time.
Yeah, well done to get all that done.
And
I
I kept
know.
it all a secret too, because I was like, I don't want people to know how many balls I'm juggling right now. I'm gonna announce this when I have time to.
Yeah, I think it's that. Is it the phrase where it's like a duck or a swan on water, like looks as though it's gliding, and then underneath feet are just kind of like paddling and keeping on top of
Yeah,
stuff.
that was me
Uh,
for a really long time. So yeah, I think that took about 3 months to like finish the build out of that. So once that was done and Stu is, off of all of his medications that he had to take from all the blood clots he had, then we're like, oh my gosh, like life is just like normal now. Like, what do you mean? Then
well,
it's easy.
I know I did quite a brief introduction there. Obviously, you've mentioned about you in person as well. But
Mhm.
before we kind of like dive into the topics that we had in mind, for everyone listening who might not know your background in training, education, basically getting to the point where you're at now. Just want to give a little bit of a background to yourself.
Yeah, absolutely. So I'm actually originally Canadian educated. My undergraduate's in kinesiology from Queen's University, and then I actually did my doctoral program in chiropractic. I worked in private practice for 3 years in Canada and then transitioned to the US. Wrote my licensing and board exams in chiropractic, physiotherapy, and acupuncture. And then now I own a online business doing sports rehabilitation for powerlifters and strength athletes, and I own an in-person clinical practice.
Ah, cool. And was
Mm-hmm.
the obviously with your own training as well, was that always kind of the route that you wanted to go
No.
down or no?
So it's interesting. So when we do our internships, there are some little pockets that you can apply to get into that are really specialized. And I actually did one specific internship in chronic pain management and pain psychology. So, I mean, that I've kind of used in amalgamation with my undergraduate degree, which was kinesiology, because you learn about sports psychology, but then understanding pain psychology is also a really interesting layer. And I do actually find that although my specific studies were not in sports, I'm okay with that because I don't feel it's particularly nuanced by the time that it's actually hit the curriculums. Not particularly nuanced. Like they're still teaching like Stu McGill's Big Three, and that's it for low back rehab. It's like, okay, phase one of 12. So, that's what they're still teaching in schools. But I'm actually really grateful that my education was specifically in chronic pain management and pain psychology because that is super important for athletes. Because we know that pain perception is not just nociception, which is tissue damage. Pain perception is the emotional appraisal of the pain that you're experiencing. And so when you're in a situation where you're an athlete or you're competing, or there are certain elements of your identity that ride on your ability to perform, that creates a super compounding layer of how somebody perceives their position in terms of injury or rehab.
Yeah. I always like to ask that question of was that always the plan? Because I think sometimes yeah, the um things have a way of kind of like directing you into different things. And then the other thing would be obviously I know you do, in person, you've got your online business as well. Was it the in person that came first and you gravitated towards online? Was online always something that you wanted to do?
Yeah.
Because especially for the coaches listening, I think sometimes it's a case of, we want that balance, or people want that balance between online and in person. So essentially they can help more people. And obviously, in person, you kind of like refined to that certain area that you're living in. But what was kind of your plan with that? Was it always wanting to work in person or gravitate towards online?
Yeah, honestly, I'd never really thought about that. I just knew that I wanted to help people. And it's kind of interesting because, when I was doing my studies, I was in Toronto, and the majority of the population that you're serving are actually people who can't even afford to use you as a doctor,
Mm.
because that is one of the healthcare spheres where, even in a socialized environment, wasn't covered by the government unless you worked for the government. So you're kind of trained to like meet a different population. Then when I got into more general population, I would say within 6 months, I was like, this is not working.
Yeah.
Like, powerlifters come in, they're hurt. Okay, you treat them, you send them back to the gym, they do the same shit that hurt them in the first place. And then you're like, oh no, I can't believe you come back and you're hurt again. And I was just like, I feel like a crazy person. Like, this is just the same loop over and over again. And, when I had met my husband, and we were in a really unique situation living in Canada because we had lockdowns for COVID that lasted almost 2 consecutive years of gyms not being able to open. So it was also like an opportunistic kind of transition where, he was transitioning his business to online, and he was like, there's so many people that I need your help with, because they're going to go to a practitioner like you. They're going to tell them to stop training. And then I'm not going to be able to help people. And how are people going to hit their goals if all they're told to do is stop training? We know that that's not going to help them. So he's like, they need a doctor like you that they trust that's telling them just how to get back in there, like how to appraise the situation. And so he asked me if I'd be willing to start doing intakes for them, which was not even like medical evaluations per se, but having the actual background training of knowing how to ask the right questions is such an amazing skill, right? And we do so much of that in school. So he was like, wow, like the information I got from an intake where you did with my client, it makes you think of all these other variables that, you may not have considered. So I just started doing all the intakes for Kodiak. And in that, now we discuss like accident history. We've gotten people like appropriately diagnosed with like ankylosing spondylitis and other really like severe inflammatory diseases that just present as back pain, where any other coach, they wouldn't really, I would not expect them to be able to know those signs and symptoms. So it's really cool how that transition naturally. And then seeing more of those people in person. But interestingly, I actually do find that the online approach, I actually find that gets better results.
Interesting. Little
Yeah.
bit. Well, there's a couple of things in there. That last point I thought was I thought was interesting. But you mentioned there about powerlifters, strength athletes coming in and then ended up going into the gym and doing the exact same thing, or doing a lot of the, like, I've used the McGill Big Three myself. You hear a lot about that in kind of like education, but it's kind of everybody ends up doing that. Whereas I think the key thing that I'd like to hear your thoughts on is how do you kind of increase that efficiency of being able to help people actually uh, start progressing and getting out of pain, or being able to add in different exercises or prehab or rehab exercises to be like, okay, right, I'm actually heading in the right direction, rather than having that cycle of doing the same things, getting injured, doing the same things, getting injured. How do you kind of help
Mhm.
with that efficiency? And on the last point that you mentioned about more getting better results online, is that
Mhm.
because you need to have an efficient system to actually
Mhm.
allow them to work? I know there was quite a lot there. I hope that kind of makes sense, but yeah, does that kind of make
Yeah.
sense?
Well, I'm hoping I'm going to answer your question appropriately. There's three main things that I look at. One is the mindset of the person. I can't divorce that from my education at this point. So there's like a huge psychological appraisal that happens in the first intake with the person, and all that really does is dictate how I connect with them. Right? Some people need you to be harsh, some people need you to be gentle, some people need hand holding, some people need distance. That's fine. But it's my job to figure out how to reach you.
Yeah,
The other thing is the setting of their actual anatomy. So we know that anthropometry or the specific dimensions of your body are going to dictate where you're going to have better leverages, how you should be lifting, where your deficiencies may be. So just actually doing an assessment of the body and being like, you're having pain in the squat. These are the requisite mobility things you need to have, or these are the strengths you need to have. If you don't satisfy those, we're going to have pain in the squat no matter what. So even if you squat perfectly, but you have terrible hip mobility, you're probably going to have pain in the squat. So I have to have an anatomical assessment where I'm kind of hitting that stuff with rehab as a bare minimum.
yeah,
And then there's the technique or the expression of the aggravator. Nothing will ever get better if the aggravator that got you into that position is not addressed,
yeah,
ever. So if I give you all the right mobility, all the best rehab in the world, I treat you for 10 hours a week, and you go back and you deadlift the same way that got you hurt every time, you're never going to get better.
yeah,
So the technique component is so big to me because you can follow through with everything else, but if that thing is still there, we're going to be in this cycle for a really long time. So appraising, their bracing strategies, what are their leverages and how would they actually, how should they lift in a way that, exploits that, honestly. Like we're trying to get the biggest total. We're exploiting our leverages as best as we can. And figuring out where their weaknesses are and what kind of patterns they have that led to their injury. So it kind of like what you said, the systematization of hitting all of those variables is so important because nothing can be solved without all of those being hit.
yeah. And on the flip side of that, because you know. especially from so a lot of powerlifters that I work with are beginners to intermediates. There's a few that
Mhm.
are progressing a little bit a little bit further up, but
Mhm.
probably more so, like, I could be wrong whether in the US and Canada as well, but sometimes the physios that they're going through don't have an understanding themselves of
Yeah.
what powerlifting is, what strength sports what strength sports are, and sometimes
Mhm.
just saying, okay, don't squat or just reduce the load a little bit. Is that where you would say that it kind of prolongs kind of that injury or that discomfort or that aggravator as opposed to following the system that you've mentioned? And if you were to speak to
Yeah.
somebody who has like a
It's-
background in training, like, will both processes work? One's just longer than the other, or is it a case of just dropping the load down? Is like, because I know I've been there. I had an injury to my back, and yeah, I just got told to drop the load down, and I was a little bit like, but yeah, I'm still not fixed. Like, it's still hurting. Do you think that's like both sides work, or is it a case of one's just kind of like drawing out the inevitable of people being, do you know what, actually, I'm a bit fed up of this now. I'm gonna go do something else.
But it's funny that you say that because even just hearing you say that your recommendation was, to you was to drop load, I'm like, oh, that's kind of like the last variable that I'm worried about,
Mm.
ironically. Because there's so many things that I would think about first. But like I kind of categorize that as like that's kind of the homework. And I think that, when you look at those graphs where it kind of is like a flow chart between like rehab and training and rehab becomes training and vice versa, at some point it's less rehabby and it's more training. So if a person doesn't understand how to appraise or how to go through the process of video analysis for a sport, you're in trouble.
Yeah.
So, like, I would never claim to be the best person to go to for a golf injury because I can watch somebody swing and I could probably make a couple recommendations, but not somebody who's like eat, slept, and breathed it for 10 years that would pick up on every minute detail to the millimeter of where you messed up, which is where I feel like I really excel in powerlifting because I could watch a video online and be like, I know why you have pain. I don't even need to hear your story. I'm sure it's great, but I already know. So, I do think like that is a really important element of it, but at the same time, I can appreciate practitioners that we don't get taught any of this in school, by the way. The only reason why I know anything is because I've been doing it for a long time. I've been coached. So having a coach that through the process of video analysis, you are learning from your own mistakes for years after years after years after years and then working for an online company. So, probably 10 years now of watching videos over and over and over and over until these patterns literally scream at you,
Yeah.
right? Which creates a little bit of trickiness because when I'm co-managing with other coaches, which is like the majority of times, it's a coach that would reach out to me being like, I have this athlete, I really don't want to hurt them. Like, can you help me? I never want to step on their toes. And I try really hard to be like, hey, like this is a doctor's recommendation. It's going to be different than a coach's recommendation. I can give that to you, and you can make the decision based on how well you know this athlete, what you want to take from it.
Yeah.
But when I appraise the situation and I go to the coach and say, these are all the deficiencies in their lift, and they go, I think it looks fine. That kills me. That kills me. Because if your job is to coach, you're not a programmer. ChatGPT is a programmer. You're not a programmer. The merit that you bring to the table is being able to identify the deficiencies that the athlete can't. Because we can't appraise our own situation. We shouldn't. The best powerlifters in the world should have a coach. But, your job is to be like directing them and coaching them toward having the best technique possible. So if an average person is lifting and you're like, your response is this, that's not coaching to me. So it is really hard when, you sometimes get a case and you're like, there's 15 things wrong with their squat. And they're like, I think it's fine. It's like, well, they would have no pain if it were fine.
Yeah. I think
But
that's
it's very tricky.
Yeah, I really like the bit that you said there about, and again, I am known for maybe going off on a few tangents, but this is actually a conversation I've had with actually a couple of members. So basically, I work in a gym in Thailand, and it's like a fitness retreat. So people can come on holiday for a week. We've had actually a guy from America who was over here for about four months, just living, training, and what I find really interesting is. So I was a PT coach in the UK for like 12 years. Obviously, recently moved over. So the experience that I've had is mainly in the UK, mainly training people from the UK, whereas people you see from all over the world. And I got chatting to, I can't remember whether they were from Holland or like Saudi or something like that. And I was like, oh, I was in the gym training myself. Oh, what are you doing? Are you coaching with anyone, working with anyone at the minute? I was like, yeah. I've got a program off ChatGPT, and I was like, oh, okay, cool. Like, what is it? What is it for? And basically, she showed me everything that had gone through, and it was just kind of like the most generic thing it could be. Don't get me wrong, programs can start off quite generic and get a little bit more. They can get specific as they go. But then I was watching her do the exercises, and I was just a little bit like, mm, do you actually enjoy? Are you enjoying this program? Like, do you feel like you're progressing on it? And she was like, well. I've been doing it for like 6 weeks, and the phrase was, I'm getting there, and I'm a little bit like, is that what you want from an actual
You know
program?
what the consumer disease is? People overpay for products and they underpay for service.
Hmm.
Service is everything.
Yeah.
You can get anything you want online nowadays. The implementation and the knowledge set of people who have been doing this for 10, 20 years that have seen hundreds and hundreds, if not thousands, they will save you so much time and energy. It's not even funny. Like, I got my first coach at what, 27 or 28? And I was like, you know how sick I'd be if I did this at 17? You know what I mean? Like, I would have literally in that decade would have had 3 decades worth of skill development.
Yeah.
But it's like, oh, well, I bought programs. Well, now I know eggs were in the wrong basket, and it's the service that you really want to pay for.
Definitely. And I have conversations with clients all the time about this of, what I'm suggesting, what I think would work is to that person. Yes, I know you've mentioned there, you're watching lots of people, you get an idea of patterns and what might show up. But one thing you kept saying earlier was, that person, you're actually working with that human, that person in front of you. So even though, there might be similar symptoms, you listed beforehand about how do you communicate with with that person, what environment are they in, you listed all of those things, which is going to change that approach slightly. And that kind of goes into the next bit that I wanted to talk about, because as powerlifters, as people involved in strength training, we want to go into the gym and train. We want to be able to lift weight. And when we get told, oh no, you can't do this, it's kind of like wanting to go against that and, oh well, I'll go in and train anyway. That'll be fine. But then the injury might get worse, or anything like that. And you kind of touched on it a little bit before, but how do you balance kind of um, the what's the best way to word this? The variation of exercises that might need to be implemented
Mm-hmm.
to keep them training, plus the kind of like rehab exercises
Mm-hmm.
um, to make sure that they're getting out of pain and progressing. But then also, we touched on it before, we all want a bigger total to make sure that they're still not kind of like losing strength. How do you kind of like piece that together? I know you've mentioned about how, you're working with other coaches, but ultimately, people want to see that they're progressing, whether that's if they're struggling with a deadlift, they want to still see that they're progressing in their bench and the squat, and realizing that they're not going to never be able to get back to where they are with deadlifting. So how do you kind of piece that all together so that it's still a balance between training and kind of like recovery from injury, rather than the powerlifters feeling as though, oh, I'm not doing anything to help me get stronger, if that makes sense.
Right. Yeah, I mean, like I've been doing this. I've been almost 8 years in practice now, and in school for almost 10. And I don't think I've ever had a situation aside from like there was a couple situations of like emergency surgery where I was like, you need to go to emerge right now. Even then, I'm like, here's some stuff that you can do while you wait. But there's very few circumstances that, maybe aside from those, I don't think ever have I told somebody to stop lifting. So, it's really hard for me to answer that because, like I said, everything I do is like so individual. But if I were to like simplify it as best as I could, there's essentially two different categories that we're looking at. One is the 10-year, power lifter who's been doing this forever, like usually the more heavyweight people, the people who are kind of like career power lifters. And then you have like the newer lifters. In the career power lifters, it's really a unique presentation because typically it's not an acute injury. Usually it's like, I've been having this elbow pain for 6 years and now you're going to fix it, Jem. And it's like, great. That's awesome. And so typically, like a very easy approach that you could take with people like that before you would ever like actually take away bench, which again, I've never even done that, would be starting with undulation cycles. Because the bigger you are, the stronger you are, and the more fatigue that you're required to dissipate, the less you're actually going to be able to, at a high frequency, touch the heavy stuff. So I would start with even just undulation work. And then I always do what I call hiding the vegetables in the sauce, which is like, I don't want to prescribe hours of rehab for people, but what we can do is we can be selective in the variations that we choose for your accessory work that are also going to include elements of the rehab that we'd like to implement. So, for example, shoulder pain in the bench. Everyone and their grandma, right? Especially the guys who have been benching for 10 years and have over a 500 bench. Every single guy does the same thing. Or it's elbows. But it's like these guys have no T spine mobility. Okay, so why are we not doing rowing variations that actually require rotation? Why are we not doing lat variations that actually make you move your rib cage through full ranges of motion? You don't need to sit there and stretch out your T-spine for 30 minutes before you bench, but you need to be consistently exposing yourself to ranges of motion that you can actually generate force through. That's what's going to have a long-term outcome. So that is one way that I look at program modification in like a more experienced lifter. And then with less experienced lifters, it's kind of a couple of things. One, there's usually a period of we need to have the primary goal of just getting you out of pain.
Mm-hmm.
Because pushing through pain, especially in a sport where there's axial loading and you have an athlete that may be less consistent with their technique and their bracing ability, you don't really want to put them in a position where they're going to get hurt further. So what I do is like the most easiest rule of thumb is increase relative intensity while reducing absolute load. So that could be 5-second eccentric tempos. That could be, anything that makes it feel like you want to blow your brains out, but there's 35 pounds on the bar, right? So they're going to still have a good training stimulus. They're still going to have a good, especially sports psychology. They want to have the perception that they worked hard in that session. We can do that. We can definitely do that. And then typically in terms of variation, it's either, something that's going to specifically help with pain modification, or it's going to be something that emphasizes whatever technical breakdown they have that led to that problem.
Yeah. And I think the things that you've said from there, which I'm kind of like nodding as you speak in there, using that in the program that they might, already have, changing some of those variables there or swapping things around. Whereas probably more so speaking to the beginner side of people for powerlifting who maybe this is relatively new to, because I've coached beginners who are 18, 19, just kind of like getting into the sport, all the way up to people in their late 40s, 50s who again have just started training a little bit later in life, but it is still relatively new. And then they go into these physios, and it's kind of two separate programs. They've got their current training program, and it's like, right, this is what we're going to do, and it's trying to have their physio program, which I think from the client's point of view can sometimes feel like, right, well, do I do this as a warm up? Is this just like one massive long warm up, and then all of a sudden they're training for 4 hours, and it's like I haven't even touched the barbell yet? Do you kind of just want to slot different things in from there, and just try and make it so that because I think part of when it comes to injuries and adding these exercises in, there's that maybe um, not fully understanding what they need to do, or that fear of like, well, like, is this actually going to help? Am I going to be able to do this right? Is this actually going to impact my lifts? But from what you've said there, changing some of the variables or adding in different exercises for the range of movement, does that make it feel as though, um, kind of to sum up there, there's like less fear around their injury, and you're kind of giving them the confidence to be like, you can still do this. We're just going to change this, this, and this, rather than being like, oh my God, you're going to have to do all these 10 exercises in your warm up before you can even touch a barbell. Does that kind of make sense?
Yeah, no, it's so true because, like, again, from a psychology perspective, like, there's a huge difference between going up to an athlete and being like, okay, so you got this problem. We're not going to do this. We're not going to do this. We're not going to do this. Or going up to them and saying, okay, amazing. We have all these different low hanging fruits that we can work on. We're going to add all these elements to your training. So we're going to send it on this one. We're going to send it on that one. And then they're like, sick. I have all these things that I get to work on. And, I'm like very pro collaboration. So, like, every athlete I've worked with that actually has a coach, they will hear from me. Like, I will send them a report with every word that was transpired, like every word that transpired in that conversation will be typed on a piece of paper, categorized, hyperlinked, completely like laid out, like, this is what I'd recommend for squats, this is why, this is the technique, this is the cueing, this is the variation, these are the accessories. And I would write that all out. So if they have a coach, the coach gets all of that information. And they're also like, typically will call me or we'll have a conversation on WhatsApp or whatever, just to make sure. Because for me, it's like, it's also a really fun part of my job, which is that I get to help coaches help their athletes. Cause I mean, coaching is just so different now. Like, I feel like powerlifting used to be a like pretty dog eat dog kind of environment. And now I'm getting all these amazing younger coaches that care so much about their athletes that they're like zooming into their intake calls with me, and they're wanting to be a part of that process. And it's really fun to be able to like help them be like, hey, next time you see this problem, look for these things. You could try this system that I've like thought of, or you could implement a couple of these variables, see if it helps them. Because coaches are a really important part of like the healthcare team that people forget. It's like we see them for such a small period of time, and you're with them all throughout the week while they're doing all these things. Like, why wouldn't they want, like, why wouldn't you want them involved? And then if I don't have say a coach is not working with the client, then I also offer subscription services where people send me all their videos. I coach them through all of their scary, whatever session they have where they're crashing out. That's cool. That's literally what I'm here for. And, giving them the confidence to like be able to problem solve.
Yeah.
And once you
Yeah.
go through that for a while and the systems, then it's like next time you have pain, you're like, oh, well, like Jem already told me, try this, this, and this, change it in this way, make sure I'm doing this in my technique. And they should be able to watch their video back and be like, did I do it or did I not?
Yeah. Yeah, I
Right.
think that thing of what you mentioned earlier about collaborating. I think there is definitely a shift with that. I know for me, when I first started out coaching PT in the UK, it was very hard. I think sometimes the level of yes, there's levels of knowledge, and I'm always kind of I would much, and that's part of the reason why I kept going with the podcast, to speak to people like yourself who have that level of knowledge that people can learn from. I'm all for kind of putting people to the right people. Whereas I think definitely now, so an example that comes to mind is she's American. She lived over in the UK and worked in the UK. She's actually moved back to America now, but she's just having a little bit of an issue with her shoulder. I was
Mm-hmm.
like, would it be okay if I kind of like emailed your physical therapist as well? I said, just ask him. He emailed me back, and I was like, here's some videos of her bench press. Like, this is the weights that she's using. This is kind of like what I think is happening. And then we've ended up being able to have like a little bit more of a conversation. the
Hmm.
client is involved in that, and it's kind of like, cool, we can like keep you
Yeah.
progressing, like, because I think with anything, if, and again, this might be a little bit of a tangent, but if the client or the athlete feels like they're the middle person, and they've got to kind of like tell, because I've had it
Yeah.
before. I'm not sure whether you've had that before, but like
Oh yeah.
information gets missed, or they've kind of like not said it, or which, I'm not the biggest fan of. The client and the athlete just gets frustrated because they feel as though like I'm literally telling you and I'm telling you, all I want
Yeah.
is,
Telephone all day.
yeah, all I want is to feel better and feel stronger. Is that something like you've experienced, or?
Oh yeah, I mean, that's why it's really tricky when, sometimes you get all sorts of different coaches, and like my goal is always to support the athlete and the coach. I do genuinely care about that. And like I said, like there are obviously circumstances, everyone has different backgrounds and different experiences that lead them to maybe not trust or not want to have somebody else involved in their case. But then, when you're dealing with a health situation that could lead to permanent consequences, they should probably lean on my liability insurance because chances are they don't have any. But I'll just say, let the doctor take the liability. Do not take on the liability yourself. That is a very bad idea. But some people, it's like they're remiss from accepting your input. And it is really discouraging when like I'll have a say they have a coach, they're like, my coach is going to take all your information, we'll follow up in a month. Great. And then you follow up and you're like, great, so did we try this? No. Okay. Did we do this variation? No. Okay. And it's like, okay, so you're worse. Pain has progressed. They didn't take anything I said into consideration, and now we're where we were a month ago, and you've wasted 4 weeks of your time. So
Yeah,
that's really discouraging for me, because my recommendations are for nothing more than to help somebody. Like, what other motive exists? Like, I'm not a coach. I'm not going to take them on as their coach. I'm just trying to assist in amalgamating that rehab coaching, because I mean anyone in my field knows like the worst thing that could happen to somebody is that they stop exercising because of an injury.
yeah.
Like there's no case study that you're going to find that says they were better off because they decided to sit at home instead. Never. Like that literally doesn't exist. So any, doctor that discourages someone from working with a trainer, it's only sensical if the trainer is not willing to bend what they want to do to what the athlete needs,
Yeah.
which is
The
quite rare.
Yeah, I think
I
the
mostly find them very receptive and really collaborative and super, like I said, sometimes they even zoom in and they're really happy to learn from the experience and to collaborate. And that's like 99% of what I see. And I've had a couple of weird situations where they were like, no, this is fine. We're going to do it my way. It's like, okay, well, when they end up with a permanent disability, you don't have liability insurance for that. So it's not going to go well.
Yeah, I'm always kind of like, I don't know why I end up always using like car analogies on this, but
Mm.
it's kind of like when you take your car, if there's something wrong with your car, you just kind of like trust the
I know,
you
and it's
you just
vulnerable, but we
yeah.
all have to do it.
Like, yeah, but I just think it's kind of, people have, like yourself, have those expertise, have that knowledge, have that experience, and it's kind of ultimately, like what we've touched on a couple of times, is what's going to be best to actually help that athlete, help that client, because, they to them, yes, regardless of the level that they're at, but yes, powerlifting is a hobby, but included in that is people's community, people's friends, people's I've got some clients that tie in their holidays with competitions and meeting people, and sometimes it's bigger than that. Going back to what you said at the start, how important is it to that person, their environment, those sorts of things. I think all of that takes a factor, and if that isn't um, treated with I don't know if seriousness is the correct word I'm looking for, but or maybe
Mhm.
care. Ultimately, you want them to get out of pain and progress from there. And the last thing I kind of wanted to touch on was when you've mentioned about different exercises to access range of movement to help the bench press or anything like that. Do you think that actually, the system, the process that you've mentioned there can actually lead them to getting out of pain and then actually progressing even more? Like if they had certain things that were limiting factors, you mentioned there about, maybe addressing technique on their deadlift. Do you think actually that sometimes that can help them break through some of the limiting factors in terms of mobility or anything like that, to then increase their total even more, if that makes sense?
Oh yeah, I mean, I would say most of my athletes end up increasing their total after fixing their problem because like the problem is also precluding you from that next level,
Yeah, yeah,
right? And then if that problem arose from poor technique, that poor technique is also precluding you from that next level.
yeah,
But like I try to be as transparent as possible because like statistics have to be clear. And there are obviously situations where people who've been in powerlifting for a long time, they're hitting insane numbers. And then depending on diagnostically what's going on with them, like sometimes you just have to be frank of like, hey, like after the cartilage is worn out, it doesn't exist anymore.
yeah.
You know what I'm saying? I think the oldest powerlifter I've worked with was 78 years old.
Wow.
Yeah, it's so cool. And, like she's got knees that are, having a hard time and she gets her like injections for those, with her pain physician. And it's like, we're going to be realistic with expectations and that will be completely person specific. And I'm always going to be honest with what I think. But I would say vast, vast majority of people are looking to actually hit PRs after they rehab. And if you rehab properly, you should come back stronger. But there's obviously situations like what happened with my husband's knees. It's like, yes, like you literally destroyed every ligament in your knee. And then once he had the surgery and they were getting up walking again, we realized he completely fucked up one of his hips.
Mm,
And I was like, oh my God, like we don't have the ability to now MRI that hip and to figure out what's going on there. He's obviously not going to have another surgery, right? Like we were just traumatized by the severity of what this was in the first
yeah,
place. And so it's like, it is a very hard pill to swallow to be like, well, you have bilateral patellar tendon reattachment surgeries. It took you 6 months to be able to walk normally again. And then you also tore a bunch of shit in your hip that went undiagnosed because the severity of the injury was so high, they had to triage what was most important.
yeah,
So with a patient like that, I'm going to be like, we can definitely get you back squatting. Do I think it's wise to have the objective of surpassing your last PR? I don't. I wouldn't encourage that unless their entire life was banking on this. I would be like, these are the statistical probabilities of what you're looking at given the surgical history you have. If you still want to pursue this, I will do everything I can to get you there. But I'm still going to be honest about like the realistic nature that not every condition is conducive to that goal.
yeah,
It's not super common, but in situations where that is the reality, I can't lie about that.
yeah. I think it comes down to, managing those expectations because I think sometimes there can be promises made, time frames given where actually,
Mhm.
exactly like what you've said, it's better to be honest and give, like what you've said all the way through. These are the suggestions, recommendations that you would make to help that person. But yeah, not at the cost of another injury or, something more severe or anything like that.
Yeah, I
Um,
really think like motivation will also get you anywhere. So it's like if somebody is willing to do anything, that does change the statistics.
yeah,
There are people built like that where they're like, if this takes 5 years, I don't care. All
yeah,
right, prove me
yeah,
wrong. Let's do this.
yeah.
Like that does exist because that mindset is really everything.
Yeah. Um, Quite a lot of topics and tangents thrown in today's chat, but really, really appreciate you taking the time to jump on, Jem, for me.
Yeah, of course.
The last question that I like to ask for everyone listening, whether it's the coaches out there listening or the athletes and the clients, but from everything that we've spoken about today, what would be your take-home points or words of wisdom from our chat today?
I would just strongly encourage people to seek help from people who know a lot about this stuff. And there's no situation that any coach should feel like, shit, I'm going to lose my clients because they're hurt or, things like that. Like, there's always resources that can help educate you. If you want to check out my Instagram, like I literally post videos every single day specifically targeted toward how powerlifters can appropriately rehab things. And I'm always very receptive to anyone who wants to shoot me a DM if they have, a client where they're like, I really don't know what to do. Like, I'm more than happy to help. But just know that although this isn't, the most like mainstream accessible information in the world, it's not like everyone knows how to rehab powerlifting. There's a lot of nuance to that. There are so many people that are knowledgeable that can help. So just reach out to people more, ask more questions, follow those accounts, learn from those people, and there's always a way forward. Literally always.
Yeah, 100%. And I'm a big fan of of that mindset because if there wasn't a way forward, it's kind of like, what's it?
You may as
What's
well just go to an MD. I'm telling you.
the yeah, thanks a lot for taking the time to jump on. Like I say, from seeing the content that you share, and kind of like your, is philosophy the right word? Just around, kind of like training, and keeping people training. I find that helpful, and I think other powerlifters, other people involved in strength training will can benefit from that. If anyone has any questions about what we've spoken about today, want to see the content that you share, which you mentioned, or reach out to you, where could people find you or reach out to you, Jem?
Probably Instagram. It's just Dr. Gem Goguen. But yeah, I think that would probably be the easiest way to get a hold of me.
Yeah. Awesome. Well, thanks a lot for taking the time to jump on. Thanks a lot to everyone listening, and I will catch you all at the next episode.
Thank you.